Good morning from the base of Mount Shasta. So something I want to talk about is one of the biggest rules I think we break in understanding healing any level of symptoms and any level of injury. This will be a short video and I'll do a longer one later today when I get inspired to break it all down because it's deep. I've clinically seen it abused in over 25 years. I've personally abused it and seen the effects. But that rule that we tend to break, and it's a perfect mechanism by the body whenever there is something to be seen or understood. It's the rule of slowing. Take you walking at your normal pace, 4 or 5 miles an hour. If you were to have damage to the body, you would slow down to a limp, to a crawl. There's a reason for this, and it's not to piss you off or become a nuisance or because of an attack. Same thing would happen with what they would call autoimmune or neurodegenerative or neurological, cardiac, brain, digestion, skin. It doesn't matter what the symptom of healing is. There's going to be a slowing component to it, and all of medicine is here to annihilate that, because the mind of you is like, I can't stop living how I'm living or doing what I'm doing. I need to keep going. And that's why we come up with all these tricks and hacks, is to make you feel better instantaneously, or to do some sort of treatment or therapy or something to get you to feel better now. And why is that? So you don't have to slow down. So you don't have to leave the current flow of the life that you're doing. And this is literally one of the biggest rules we break, and we have to pay for this because you have to be obedient to your body, not obedient to anything outside of you. That's not what I'm talking about, but obedient to your body. So are you one that breaks the rule of slowing? If so, why? And then how can you use that as a power? Because it is a superpower. How long does that last? It's totally conditional to the person, case by case, symptom by symptom, injury by injury. There's no way to know. But there is a perfection in the slowing that occurs with injuries and all symptoms. More on this later. Boom.